remember, you are purchasing, you're not purchasing the badge, you're purchasing the service. Okay? You don't own these, you're purchasing the service. So every 3 to 4 months, they're getting read, they're getting analyzed, and they send you the information. Okay? Each time they do that, it's costing the hospital or clinic a lot of money. Now, because they're expensive, this is where it becomes very objective with whoever you're working for. It can be a clinic, it can be a hospital, okay? It can be a medical center. If they're expensive, they are least likely to send these badges out within the correct time frame. They should be sent out every 3rd or 4th month, 4 months to be read and analyzed. Each time you send it, you know, you're paying for the service. Now, if it's expensive, some people will opt to send these out every 4, 5, maybe 6 months. The longer that it takes you for the company to send this out, what if you were exposed to some high dose of radiation? Okay, you wouldn't know it until 5 or 6 months down the line when it gets read. Whereas if you had this read every 3 or 4 months, you would know if you were exposed to a an unfavorable situation, and they can take care of that immediately. Otherwise, you've got this large exposure, and you keep working in that same type of environment, and over and over and over again, and pretty soon you keel over in a couple weeks. But I mean, you know what I'm saying with that, right?
Yeah.
Okay, that's why, you know, although expensive and although very accurate, the more accurate they are, yeah, the more expensive they get. Okay, so again, we said the collar is going to be worn outside of the apron, collar level, not in your shirt pocket, not in your pant pocket, your loop, etc. Worn under the apron for certain circumstances. Who's that for? Pregnant technologists. Kind of sounds like an oxymoron, right? Pregnant technologists. Well, yeah, there are pregnant technologists. I've worked with pregnant cardiologists and pregnant radiologists who work around x-rays and fluoroscopy, around live radiation. Why? Because they understand the beast. They understand and respect radiation, and they know what it takes to practice good radiation safety. I have worked with female doctors from the 3rd month all the way until a week or 2 before they had their baby. Child is fine. Okay? So worn under the apron. Reading of device considered whole body. So again, although it's up here on your collar, the reading is translated into a whole body exposure. Devices are worn to assure limits are not exceeded and change out monthly or quarterly. So we do it every month, or we do it every 3 to 4 months. If you have an overexposure, okay, so you get your report back and you're looking at your records and saying, oh my gosh, I've exceeded my records. Because we get the reports back. Sometimes it passes the radiation safety officer's desk or the manager, and because it's also our responsibility to keep track of our exposure. Okay? If I'm going through my chart and I'm saying, ooh, I got a high exposure here, I need to get in touch with my supervisor. Even if you think it's erroneous, even if you think it's a mistake, you still need to report it. And we need to investigate it. Overexposures, and what we mean here is if you're getting a little bit more than you should, it generally happens in the cardiac cath lab and special procedures because we are using fluoroscopic units in these departments. Okay? Fluoroscopic units. Now again, I've been working in the industry close to 25 years. I still work in the cardiac cath lab. I feel good. I feel fine. I feel very healthy. There's nothing wrong with me. I did lose some hair, but you know, I'm okay. And my skin's wonderful. Okay? And you can also get it through careless portable work. When you're doing x-rays outside of the radiology department, you're doing x-rays using your portable x-ray unit or portable fluoroscopic unit. You don't have the walls and barriers like you do in radiology. Okay? And this is where they get kind of careless. Remember I said, what is your minimum distance away from the source and the patient?
6 feet.
6 feet. Well, I've got them, there's the patient, they're doing the x-ray. Boop! They get lazy. All you have to do is just take 1, 2, 3 more steps back, and you're good. But they don't, it's like, that's too far. Boop! So they expose themselves to scatter radiation.
So it's self-inflicted then.
It's self-inflicted, it's laziness. Yep. And besides, if you are doing portable work, what should you be wearing anyway? A lead apron. Right, got it. You guys are awesome. All right, so who's monitored? And we talked about this earlier. You got 2 classifications. High radiation area and radiation area. High radiation area is any environment where you have the ability of receiving 100 millirams in any given hour. Okay, 100 millirams or more in any given hour. That is considered a high radiation area, like a nuclear plant. Okay, this high radiation area. The next one here is radiation area. This is where we fall in. This is our category. Okay, so this is any environment where you can receive an excess of 5 millirams in a given hour. 5 millirams in a given hour.
Is that considered high for us, 5 millirams in an hour?
That is our threshold.
Oh, okay.
Okay, working the cardiac cath lab, again, my annual dose, this is annual dose, 5 millirams in 1 hour. In a year, you're allowed 5 rems, and we'll talk about this later on. Okay, 5 rems in 1 year. As a technologist working in the cardiac cath lab, I've never even exceeded 1. 1, and I'm allowed 5 in a year. Okay, I'm talking about being alive around live radiation the entire time. Why? Because I understand how to protect myself. Remember ALARA? ALARA is as low as reasonably allowable. Under ALARA, there are 3 principal rules, and we'll talk about this later on. But I'm going to talk about it right now. The principles of ALARA is time, distance, and shielding. And you guys can tell me, you can tell me right now what those mean, because you know a lot. I've given you enough information that you know what these mean. Now I'm talking about time, distance, shielding. What do I mean by time?
Exposure time.
You want to spend as least time around a source. What's distance?
As far away.
As far away as possible. And what's shielding? Shielding. Protect yourself, whether it be through an apron or by a wall.
Mm-hmm.
Time, distance, shielding.
Or the doctor.
Or the doctor, I was going to say. So I use my doctor as a shield. My doctor's the one that has a higher dose than I do, but I don't. Okay? So please know the difference. One greater than 100 millirams and then 5 millirams to the whole body in an hour. All right, the maximal permissible dose. The maximal permissible dose tells you, this is basically setting up your threshold. What is the maximum dose that I can receive and still be in safe limits?
5.
There we go.
Conversion.
5 rems. Okay? To the whole body, I can receive 5 rems. Okay? This is the conversion. 1 rem is equal to 0.01 sieverts or 10 millisieverts. And then they also gave you guys the conversion for rads and grays. Okay? But your whole body, you can receive 5 rems. Now remember, I'm wearing my badge collar level near my eyes and my thyroid. And the dose that I get there translates into a whole body exposure. Now they can also take that same reading and be more specific to the amount of radiation that my eyes are receiving. Now as a whole body, I can't receive as much because we're talking about something that's whole body and something that's isolated. When you have an isolated exposure, you can receive more exposure to that. If you are talking about a whole body, where you're talking about systemic, now you're talking about killing all the cells from head to toe. And if you're killing cells and damaging cells from head to toe, you're not going to recover. If I'm damaging cells that are localized, like in my hand or my eyes, the damage is just going to be to my hands or to my eyes. And that's why the doses for skin and hands and limbs are higher, because they're isolated. Does that make any sense? All right? It's kind of like this. And I make a lot of analogies when I'm in radiobiology. Okay? Whole body exposure. If I got shot with a huge cannonball, because it's going to hit my entire body, what are my chances of survival? None. If my hand got struck with a huge cannonball, what is my chances of survival?
You'll survive, but you'll be unhappy.
Okay? I'd lose a hand, but I'd still be alive. You guys get it? Mm-hmm. That is why I can receive higher doses in an isolated area. If we're talking about whole body, I'm dead. I can't sustain that much exposure because it's systemic. All right. But we'll get into that later when you get into radiobiology. All right, non-occupational. We've been talking about occupational dose. Non-occupational. Non-occupational means everybody else in the radiology department who isn't involved in the procedure. These are people who are not shooting the x-rays. These aren't your doctors, these aren't your nurses, these aren't your techs. These are occupational. Non-occupational will be like your transporters, your receptionists, your front desk clerk, your transcriptionists, your medical assistants, your orderlies, anybody in radiology who isn't shooting x-rays or isn't involved in an x-ray procedure, because we still need to keep track of the radiation exposure because they're in with a radiation environment. They're non-occupational, and they can receive 1/10 of what the occupational worker receives. So we get 5, everybody else can receive 0.5 in how long?
1 year.
1 year.
So do they wear badges too then, or?
Yes, everybody in the radiology department has to wear a radiation badge. This is yearly, 5 rems per year. This is 0.5 rems per year. So don't just give me a unit. If I asked you what is the maximum permissible dose for an occupational worker, don't just tell me 5 rems. 5 rems what? In an hour? In a week? In a month? No what?
A year.
In a year. You guys hear what I just said? If I asked you a question like that? All right, cumulative MPD. Well, our maximal permissible dose is 5 rems per year. Okay? So what does that mean every year? What happens to my unused exposure? Is it like rollover minutes on your phone? No. Okay? So let's just say I used up 2 1 year, and I have 5 the next. Can I be allowed 7 the next year? No, because your limit is still 5. Okay? If you exceed 5, you're going to be in a lot of trouble. However, we can still determine, this is called the cumulative MPD. The cumulative MPD can calculate the amount of radiation exposure that you are allowed in your lifetime within this profession. All right? The cumulative dose that a worker is allowed during his or her employment depends on their age. Utilizing this formula, it's going to be 1,000 millirems times N, or 10 millisieverts times N, N being the age of the technologist. N must be at least 18 years. Okay? Because that is the age that you're allowed to work in California.
So it's the age, not the amount of years you've been working as?
It's the age. It's the age. Okay? Again, it has to be at least 18 to work in at least to work in California. Now, it's funny because one of the students who this is their first year. Okay, when we first got her into the program,
Emergency?
All right, guys, let's go. Grab your